ttalk एक Boond Soch powered by Dr. V.N. Brems, Medical Institute of Management and Ajmera. Today again we are having Dr. Sanket Mehta on this platform. Sir, welcome to the show again.
Thank you so much.
Dr. Sanket Mehta is the President of the Society of Peritoneal Surface Surgical Oncology of India and also the Director of SSO, that's Specialty Surgical Oncology Hospital in Mumbai, and is well known in the country in the field of Cytoreductive and the HIPEC surgery. Sir, welcome again. Now, in fact, can you throw some more light in terms of gastrointestinal and the abdominal cancer?
So, what do we mean by gastrointestinal is cancers of the GI tract, which starts with the esophagus, and the stomach, the small intestine, and the large intestine. But it also includes other organs linked to the GI tract, like liver cancers, pancreas, and spleen. Now, when these malignancies develop, because they are internal organs and they do not necessarily have pain nerves, symptoms like pain are very late in the development of the disease. In fact, by the time the patient has very overt symptoms that they need to be hospitalized, it's already too late to treat. And often screening is the best way to detect early cancers. One thing that we always tell patients is that if there are any symptoms which last for more than a week or 10 days, which are not getting relieved by standard basic treatment by your family doctor, you should seek help with either a gastroenterologist or an oncologist to ensure that we are not missing a malignancy. Another thing that is very important is if there are any abnormal symptoms like jaundice or yellowish discoloration of the eyes or vomiting or altered bowel habits where you are having alternating diarrhea and constipation or spurious diarrhea or blood in stools. These are all very alarming signs and should not be neglected, and you should seek help without any delay.
In the practice of 15 years in gastrointestinal, what are the patterns which we have seen, changes in the pattern?
Oh, a lot of changes. So from treatment perspective, I can definitely say that the treatment has become much safer and much more advanced. There is a big impact of minimal invasive and robotic surgery. So surgeries which are done by keyhole access so that the patient's body wall is not violated, a patient recovers much more quick, faster, the return to work is faster, the time to adjuvant therapy is cut down, so the duration of the treatment goes down and patient recovery is far better. Apart from that, we also now have various treatments apart from chemotherapy that are available, including targeted therapy and immunotherapy, which is making a big impact in advanced malignancies, where diseases which were considered incurable with a very short lifespan are actually living much longer, more productive lives, and even with a small chance of cure, even in stage 4 cancers.
And doctor, how these GI cancers linked to the lifestyle,
Yeah. So I think with urbanization and with a more sedentary lifestyle, with a lot of processed foods, lack of exercise and obesity, these are all risk factors for developing GI cancers, including stomach cancers and colorectal cancers, as well as liver cancer. If you add to that exposure to carcinogens like smoked foods, like tobacco and alcohol, the risk multiplies. So all this are avoidable and modifiable risk factors which need to be addressed.
Okay, I think listening to Dr. Sanket Mehta on ttalk ek Boond Soch, I'm sure there are certain warnings which normally I think you should take precaution as for the lifestyle which are concerned to ensure it's you are away from this core problem which exists, and if you feel if there are any symptoms, just go to the doctor and get it checked before you land up with an deep cancer to a certain extent. Dr. Sanket Mehta, thank you very much for being part of this show. He is a director of an SSO, Specialty Surgical Oncology Hospital in Mumbai, and he's also president of a Society of Peritoneal Surface Surgical Oncology of India. So thank you very much for being part of this show. Thank you so much.
Thank you.